Hello. We're doing the AP Lordotic supine today because we're not doing the standing supine or standing AP Lordotic because our patient is going to be non-ambulatory, so they can't walk around or talk as well as like ambulatory patients. So we're going to set up our stuff first. We have here, we're going to have it on the chest here, AP, and then we'll make sure this is going to be wireless because this is going to be not in the wall bucky, it's going to be in the table. And then we'll set up our KVP. So we'll start off with AP, and it'll be thorax because it'll be the chest. And then let's just put like the chest PA, and then we'll set it up to as close as we can to 125. That's our limit, so put it 120, and then have our mass up to 2.0, but this is our limit as well. So we're gonna go over here. So our patient's not here yet, so we're gonna prep the room first before we get the patient and introduce ourselves. So let's pick this up, and we're bringing it up to the bucky 40 inch SID, and then we will have our I just got the digital IR here. We're gonna set it up for lengthwise because this is gonna be a static patient. All right, and then we basically have the equipment we need for our patient. Oh, and make sure they have the gown and then the shield ready as well, and make sure you have your markers ready, and as well as 2 pens so you can write down a history that you're going to take. So basically we're gonna go to the room, get our patient, introduce ourselves. So I'm JB Carpio. I'll be your tech today, and I just want to call out their name, first name and last name, and then I'll ask them for a date of birth. Once I get that, I check the wristband to make sure, and then after that I'll take them to the x-ray room. Once I take them to the x-ray room, I'll basically explain the x-ray itself. It's going to be the AP Lordotic supine, and ask them like to start our history. So I'll basically ask them, the first question I'm going to ask them will be, is there by chance they could be pregnant? And if they say no, then ask them about their last menstrual cycle. But if they said their menstrual cycle is way over before more than 5 days, then I'll ask if they had unprotected sex, and then just write everything down. Then after that, ask them what brought them to the procedure itself from the doctor, explain about that, and then try to be more detailed about it. So ask about, is there any previous reason? Do you feel any pain regarding since we're doing the chest area, so anything from the chest area, any pain at all? And know like the scale from 0, because sometimes they don't have any pain, up to 10, 10 being the most amount of pain. And then ask like when did it occur, like how often did it occur, did it happen like each day, weekly, monthly, vice versa. And then ask if they had any previous illness or previous injury before what they got in. And then ask any surgery as well, any chest surgery at all. And then ask the other thing, the main important thing is ask if they're a smoker, if they have smoked and how much and what they smoke specifically. And then once you have that, then you're basically ready. You will ask the patient to go to the changing room and have them change to a gown. Make sure you remove everything from the waist up, including jewelries, bras, anything that might obscure any anatomy or show like any artifacts behind the x-ray. And once you have them changed, basically you'll have them have an open back as well for their gown, and then you'll be prepping up the room while you wait for them to change, so any adjustment or anything. So, and then I'll have the patient be here laying down, facing towards the ceiling since this is supine. And then I'll set up make sure the collimation will be, since this is going to be chest, aesthetic patient, you'll be portrait by or lengthwise by 17 by 14, and this is going to be SID of 40 inches, so make sure it's 40 inch, and 17 right here, and then 40 inch SID, you'll be 14 right here, and just make sure you check, see if it looks wider or longer, but it looks good. And then after that, you align with the vulva key here, or the digital IR here. So you'll have the line aligned to this, and just put it in. Right. And basically, once you have it aligned, you don't need to move or any of this as of yet. So then, since this patient will be, so the main thing with lordotic is you're trying to see if they have anything underneath the clavicles. So usually when you have it erect, AP lordotic, you will have them angled, and you'll basically see underneath their clavicles. Their clavicles will be protrude out, and you're able to see the ABCs of the lungs. If they have any massification or any sort of like disease or anything going on underneath that, but we can't at this non-ambulatory patient, so we'll have to angle this up to 25 degrees cephalic. So have the patient a little bit up so your light won't get into their eyes. Just to estimate, I'll position and I'll do the centering later on. So have the angle up to 25 degrees, around 25 degrees, but I'll have it on 25 degrees. So we'll have that, and then we'll have, the next thing we'll do is centering. So we'll center. Oh, before that, I'll have to align this again. Since I moved the tube, I'll have to align it to the digital IR. Make sure it's back to the light again. Since you won't hit that. So always adjust your tube and according to your relation to your digital IR here. Make sure you have enough room. So I have enough room. So right now I'm gonna start centering our patient. So to see the midline, you'll feel their xiphoid process here. So you make sure you're centered. It looks pretty centered, but you can also check behind the glass here, so you can see what it'll look like. Put the light on again. So it looks pretty centered. So you don't need to move the table left and right at all. It's centered. Next, you will have to do their CR, their central ray. So to do that, you will have to feel their jugular notch, which is right here. And then for central ray, it will be at T7, or if it was a PA, it will be your inferior scapula. So, and it will be, since you're doing the lordotic or anything AP, you will feel their jugular notch, and it will be 3 to 4 inches below that. So I'll just take my fingers here, feel this, go up here. So my central ray would be right here. So I'll have to move the table. Don't move the so I'll be around here. Check again. I'll be right here. Okay, so I'm around here. So this looks good. Make sure it's midline again, and then have your markers to make sure it's on the left side. So they'll be right here. And then another note is you can check if it's like 2 inches. The collimation will be, the light field will be 2 inches above. So it's around 2 inches. So now you're ready to take an image. Make sure this is aligned, everything looks good. And we're ready to do the breathing exercise. So you'll have the patient do the breathing exercise. It'll be their second inhale. So one way for me to help them is to do the breathing exercise with them. So I'll tell them to inhale, exhale, and I'll tell them to inhale again. And tell them to hold their breath. And then once you're ready, just press the, tell them to hold their breath and press the prep until it's green solid. And then once the green solid, press expose and you're good. And you'll tell the patient to then start breathing again. So tell the patient to, you can relax, you can start breathing again, and then have them move the tube again away from them so they can't hit the tube, and have them set up, stand up, then explain to the patient, okay, so you're finished with your AP lordotic chest supine x-ray, so you'll have them the results back from the doctor. It will be around 24 to 48 hours, and then have them change to their out from their gown to their clothes previously, and then you're ask them if they have any questions or anything, and then if not, then you will take them out back to their rooms, and that's it.